I hope you're having a great day. Well, today we're going to talk about kidney stones, and we need to understand that the kidney is an organ in the body that has several functions. Think of it as a filter. So think of it as filtering out toxins from your system, extra salt, extra minerals, excess calcium that we may ingest through our diet or supplements. A lot of people over-supplement themselves. And we have the buildup of calcium minerals that form oxalates in your kidney. And the collection of salts, the collection of minerals, calcium, and even uric acid can form into hard stones called kidney stones. Now, in most cases, kidney stones don't even cause a problem. They can be as small as a dot. But as they grow, because our lifestyles are bad or because we have a buildup of more uric acid or more of the calcium oxalates or minerals in our system, these stones get harder and bigger, and then they can cause a problem. Now, these stones can travel from your kidney to your bladder. There is a tube called a ureter, which basically connects the kidney to the bladder. Now this stone, as it starts to move through the ureter to the bladder, that's when we can start getting fevers and chills and UTIs, a lot of pain, especially pain in the side, pain in the belly area, or even pain in the back. Okay, now this stone can reach the bladder and cause a lot of complications. Sometimes we flush it out of our system. We can actually urinate a small stone out of our system. Sometimes if the stone is slightly larger, it's a painful process of passing it out through our urine. But what are some of the symptoms and what are the things that we can do? So sometimes if you have pain in your back, you have pain in your sides, pain in your belly area, you may want to get checked for kidney stones. Urination as well, where you have pain and burning sensations in your urine. If this happens too frequently, you want to check either for a UTI or possible kidney stones. When you see blood in your urine, that is the first. Immediately, you get a urine test done and you see your doctor immediately, because blood in the urine is not a very good sign. It means so many things. And taking corrective action immediately can actually help it get worse. Help you prevent it from getting worse. The urgency to urinate could also be a sign that you have kidney stones. When your urine is cloudy and it smells, it's got a foul smell, you may want to check for kidney stones again. Small amounts come out. So when you have a normal flow of urine, but if they come out in small spurts or small amounts, that also may be caused by the blockage of a kidney stone. Fevers and chills, nausea and vomiting, these are common side effects of someone who has a kidney stone. So let's go straight into solution mode. What can you do? Number one, you will get your test done to understand how big the stone is, and you must seek medical advice, because sometimes kidney stones can cause severe infections to the kidney, causing irreversible damage. So you want to make the best judgment based on the advice that you get from your doctors. Now, when you look at things naturally, yes, there are several things that you can do to break down kidney stones. Number one is your kidney bean, called rajma in our country. Kidney bean, boil it really well, soak it for about 8 to 12 hours, and then you boil it. You can actually cook it into a normal rajma preparation with a little bit of asafoetida, which is called hing. And you want to eat this regularly, at least once a day while you have it, because it has the ability to break down kidney stones, not because it's called a kidney bean, but because it's rich in fiber, okay, and it has the ability to actually flush out a kidney stone from your kidney. Apple cider vinegar is fantastic when it comes to breaking down kidney stones, because it breaks down into acetic acid in your body, which can break down a stone which is formed by calcium oxalates, minerals, or even uric acid. So having a tablespoon of apple cider vinegar 30 minutes before your lunch, 30 minutes before your dinner, can possibly also break down a kidney stone. We get something called basil. We like basil leaves in our Thai curries and a lot of Thai preparations and other international cuisine. You get dried basil leaves. You can get dried basil leaves in little bottles. You can get this on Amazon or any grocery. You take about a tablespoon of dried basil leaves and you boil it into a tea. You boil it for at least 4 to 5 minutes, okay, and you drink this thrice a day. Morning, afternoon, night, about 250 ml to 300 ml, 1 tablespoon of basil in each glass, because this also breaks down into acetic acid and helps you to break down a kidney stone. What we need to understand is you can also get kidney stones by being dehydrated. So people who have low water intakes, because we need to understand, when I said the kidney works like a filter, the medium is water. You have to flush out a filter by using water. So if you're dehydrated, you have the ability of allowing more stones and more minerals to form stones in your kidney. At the same time, if you have small kidney stones, being very well hydrated can actually flush out these stones from your system. Pomegranate juice is also fabulous. I'm usually not a fan of juicing a fruit. I'm a fan of breaking down a fan of breaking down eating the whole fruit so that we can break it down. But if you, in case of kidney stones, you can actually juice the pomegranate and ensure that the pomegranate juice will actually flush out a kidney stone in most cases. You get something called dandelion root. This acts like a diuretic as well. So diuretics are also very powerful for you to flush out a stone that may be of a small size that can be flushed out of your system. Now, celery juice is powerful when it comes to your kidneys. But if you have low blood pressure, if you have low blood sugar levels, you want to make sure that you don't do celery juice, or you do it under professional guidance. Celery juice is also a great kidney detoxifier and has the ability to work as a diuretic to flush out small stones from your kidney. And lemon. Lemon water, again, is good for your kidneys. If lemon suits you, because lemon has something called citrate, which again, like acetic acid, has the ability to break down stones. Now, like I said, you can try these things, but if you have the symptoms very strongly and you do your test and you find the stones are really big, you must get treated and you must seek medical advice. This is something for you to try. It is not a replacement for what your doctor tells you or what you need to do medically. So you may want to try these things, because for the longest time in our country and several other countries, natural remedies have worked. But sometimes if they fail to give you the desired results, you must take the allopathic way and you must do what is right for your kidney and what is right. Because we don't want to fool around with the kidneys. Once your kidneys are damaged and it's irreversible, okay, you have a lot of other problems that you need to worry about. So if you have a kidney stone, get it treated the right way. You can run nature parallelly with whatever you are advised by your doctor. Have a great day, everyone. Until next time, eat smart, move more, sleep right, and breathe deep.